You know, sometimes the nerve system, the brain, the spinal cord, the central nerve system just doesn't get enough credit. So I'm going to give it some airtime today. Now, we all know that the brain, the spinal cord controls everything, but with heart disease being the #1 killer in this country, and with all these angioplasties, surgeries and things that are done in the heart, the colon, the kidneys, you have 2 kidneys, you can get part of your liver removed and it can actually regrow once again. But very, very rarely will a person have brain surgery, so it just doesn't get as much talk. It's just not as popular sometimes. So what we're going to do today is we're going to play a game called How Long Can You Go? How long can you go without food? Well, experts say that you can go between 10, 15, even all the way up to 30 days without food. What about water? Most people say that you can go 3 to 7 days without water, and without air supply, you could go a few minutes, but without nerve supply, you could go about 3 seconds before you're absolutely done. Now imagine a new bustling town is being developed. Restaurants are going up, small businesses, offices, all these things, business park, retail area. And then a freeway gets installed right by this major state highway with all these shopping centers 2 years later. Imagine what would happen to the health of that little district if the freeway did not have an exit or entrance ramp into this small little town that is being developed. In the same way, a compressive lesion, a bruise, scar tissue, benign or even cancerous tumor inside the body can be occurring, and that can put a restriction on the normal blood, especially nerve flow, going to various organs. But a far more difficult, subtle, yet common problem is the subluxation in the spine that may be affecting the organ nerve supply among the family and friends that you have right now. You know, probably one of the best ways to demonstrate the importance of a healthy functioning nerve system is to observe what happens when a person has a spinal cord injury, when they have a neurological deficit, when they're unfortunately confined to a wheelchair. Now we know that quadriplegics do not live as long, do not have as healthy of a lifespan as paraplegics. And full paraplegics cannot use their arms or legs at all, don't do as well in life as those who are partial paraplegics, can use their arms and hands somewhat, or their legs and feet. And in the same way, assuming you are not confined to a wheelchair, you watching this right now, we all fit on that line somewhere between perfect health and being very, very sick. You know, I had a patient in here this morning, as a matter of fact. She started here because of diarrhea. She was just constantly going. And that cleared up. But then she started having lower back pain. I think her body was retracing. She actually started with some pain up here. It kind of moved downward as her body was healing. And then a couple weeks ago, she tripped at a friend's house and she bruised her head. But fortunately, she's doing better from that. She says today she feels great. Of course, everything is functioning and moving along great. And I asked her, I said, so what's the next level for you? What's next? She kind of looked at me like, what do you mean? And I said, well, you're feeling a lot better. You're not having the pain. Your body seems to be working correctly once again. What's the next thing here? What's your roles? Let's talk about that a little bit. What do you do? And what are your goals? And so we agreed that it's a good idea for her to spend some time this weekend as she walks her dogs thinking about what is it? What's that next goal? What's that next thing? What's that next challenge in order to become a better person? Is she going to attack? Is she going to go for and reach and become a better person in the process? That's what it's all about here. Better nerve supply, better you.